I've worked in emergency medicine for over 20 years, and what I've seen here and experienced here in Rhode Island over the last 8 months is unlike anything else I've experienced in my career in this country. It is much closer, in fact, to that which I've experienced working in refugee camps and battlefields across the world. Despite the vast healthcare resources in our state, this pandemic has pressed us to the brink. Our hospitals are rapidly filling up day after day as the numbers in Rhode Island climb even beyond those which we saw in the surge this spring. This is why we need to remain vigilant and do absolutely everything in our power to protect ourselves and others and to halt the spread of the virus. My message for you today is that these are not just statistics and numbers, that this is real. This is affecting our state and our communities and our people. We in your hospitals are seeing the effects of this every day. My team and our teams in the emergency departments around the state, we are seeing the real patients with COVID-19. The ones who are lucky enough to have a mild illness, like the young retail worker and mother who I diagnosed with COVID-19 earlier this week. Her life is still turned upside down despite this being a mild illness, and she is still filled with fear. She immediately began to worry when I gave her the diagnosis about how many of her coworkers, how many of her customers, how many of her family members she may have inadvertently infected, despite her best efforts to keep safe. And she'll be out of work for weeks, struggling with this virus. We are seeing the real patients who come to the hospital struggling to breathe, their lungs filling with fluid, their eyes filled with fear. We know that there is no cure at this point. The best that we can do, we know, is just to support and try to mitigate the effects of this virus. I had this conversation with a fellow healthcare worker last month. He's my age and he'd been healthy, but he, like so many others around the globe, got COVID, and he ended up in the ICU on a ventilator. He did survive, but he is now suffering the long-term effects of post-COVID syndrome. He is debilitated by chronic pain. He struggles to breathe. He has a hard time getting out of bed most days. He's one of the lucky ones, but he may never get back to normal. And he is an example of how vulnerable we all are. Even if we're young and healthy, none among us is actually invincible.